Hello, my name's Rebecca and this is my colleague Sarah, and we're part of the pharmacy team here at Velindre.
This video is about a group of medicines called Cyclin-dependent Kinase 4 and 6 inhibitors, or CDK4/6, which are taken by mouth as a tablet or a capsule and are used to treat different types of cancers. You can recognise them by their names, which usually end with lib. Throughout this video, we will refer to them as CDKs. During this video, we will explain how to store and take your CDK medication, how to manage some of the side effects, when to take medicines to help with the side effects, how to stay well at home, and when you should contact us for advice. Sometimes, if you're unwell, you will need to get help and advice quickly, so we will explain who to contact and when you should do this. The most important thing to remember is that you are not a burden. We want you to contact us if you feel unwell, because the earlier we know about side effects, the more likely it is they will be easier to treat. We want to help you to stay well and stay on your treatment. It is not possible to list every side effect that may occur. If you are feeling unwell with new symptoms or have a symptom that is not explained in this video, it is important that you contact the treatment helpline straight away for advice.
Your oncology team includes your consultant, specialist pharmacy professionals, nurses and doctors. During your outpatient clinic appointments, your team will speak to you about your treatment and provide you with written information. It is important to read this carefully. Reading it together with a family member or friend may be helpful. Write down any questions or concerns you may have and bring these to your next outpatient appointment for discussion with your team.
You should always store your medicines in their original packaging in a cool, dry place below 25 degrees, safely away from the reach of children. Your pharmacy will let you know if your medicine should be stored in a fridge. Your CDK treatment will be given to you in medicine packs that will either be a pot or a box. Each of these packs will have a label printed on the outside to let you know how many tablets or capsules to take and how often you should take them and for how long. Always read the instructions on the label before taking. It is best not to touch your medicine if you can avoid it, so take by popping it straight out of the packaging into the medicine pot provided, or into a small cup that you keep specifically for taking your CDK, and take them without touching them. Always take with a glass of water, swallowed whole and not broken, open or chewed, and be sure to wash your hands thoroughly afterwards. Take them at approximately the same time each day.
You may be also given other medications to help manage the side effects of your treatment. Never share your medicines with anyone else. Any unused medicines should be returned to the hospital pharmacy for safe disposal. Do not start any new medicines or supplements while you're taking your CDK treatment without checking with your team. This includes anything that you may buy. You should always show your treatment helpline card to any healthcare professional that you see so that they know the name of your CDK. If you're not sure how to take your medicine, you can ring the hospital pharmacy or the treatment helpline for advice.
Sometimes CDKs can interact with certain foods or other medications. You should avoid grapefruit and grapefruit juice and avoid taking any herbal remedies whilst on this treatment. If you're allergic to soya or peanuts, you should speak with your team before taking this treatment, as it may not be suitable for you. If you have taken more of your medicine than prescribed, contact the treatment helpline for advice straight away. If you are sick, do not take another dose to make up for it, just take your next dose at the usual time. As a general rule, if you forget to take a dose but remember within 2 hours, then take it then, but if it is more than 2 hours late, miss the dose and take your next dose at the usual time. If you are unsure, contact the treatment helpline for advice. Common side effects of CDKs include altered blood tests and infection or temperature, feeling tired, loss of appetite, feeling sick or being sick, also called nausea and vomiting, diarrhea, sore mouth, rash and hair thinning.
You will have your bloods checked regularly during treatment, as it can affect your blood counts in several ways. including reducing your white blood count, which increases your risk of picking up infections. Therefore, ensure you have a thermometer at home whilst on this treatment. If you have a temperature below 36 degrees or above 37.5 degrees, or if you have a symptom of infection, then you must contact the treatment helpline straight away. The medication can also reduce your haemoglobin levels. This may lead to you becoming anemic. Let your team know if you feel extremely tired or short of breath, or if you're looking extremely pale, as these may be signs and symptoms of anemia. It can also reduce your platelets. This has helped the blood to clot. This will increase your risk of bruising or bleeding. If you notice any excessive bruising on your body or bleeding when you blow your nose or brush your teeth, you should contact the treatment helpline for advice. It will also affect your liver and kidney function, which would show in your test results, but these will be monitored regularly by your team.
Feeling tired, also called fatigue, can have many causes. This can be more significant as the medication can cause a reduction in your red blood cells, known as anemia. Some pain medication can also contribute to the fatigue, as it can make you more sleepy. Your team will speak to you about your energy levels before you start your treatment. This will help them to monitor how you are feeling whilst you are on the medication. You will have regular blood tests, and your team will let you know if the results show lower levels of red blood cells and how this can be treated. Carry out normal activities, including gentle exercise. This might be walking around the house, going for walks, or more strenuous exercise if this is normal for you and you feel able to do so. If you feel tired after exercise or normal activities, listen to your body and rest if you need to. If you feel unusually tired, take care if driving or using machinery. If you don't feel better after rest, or if you're spending more than half the day in bed, or you're unable to complete any normal activities, please contact the treatment helpline.
You may lose your appetite whilst on this treatment. If this happens, try to eat small meals or snacks throughout the day to help keep your energy levels up and to prevent weight loss. Keep a record of your weight at home and let your clinic team know if you are losing weight when you speak to them at your next outpatient appointment. Feeling or being sick, also called nausea and vomiting, can be a common side effect of this treatment. If you're feeling nauseous, try to avoid fatty and fried food. Eat small meals and snacks and drink plenty of water, which may help to settle your symptoms. Take your anti-sickness tablets according to the label. You will be given some anti-sickness medication to help with any nausea and vomiting. There are lots of medicines that can treat and prevent sickness, so if one medicine is not helping you feel better, make sure you let your team know and they can prescribe a different treatment that could be more helpful for you. If you are sick more than once in 24 hours, if you are not feeling better after a day taking the anti-sickness tablets, or if you have not been able to eat or drink, please contact the treatment helpline.
This treatment can cause you to have diarrhea. If diarrhea goes untreated, it will cause you to lose lots of fluid, which can make you feel weak and unwell. If you have diarrhea, start taking the loperamide as directed if it has been provided. If you do not have loperamide and you have diarrhea, you will need to obtain some from your team or your GP. You can also buy this in your local pharmacy. Take 2 loperamide on the onset of diarrhea and then 1 after each loose bowel motion with a maximum of 8 in 24 hours. This can help settle diarrhea symptoms. Until your symptoms settle, avoid fresh fruits and vegetables and try to drink extra water to help stay hydrated. Avoid alcohol and caffeine too. Alcohol is dehydrating and caffeine stimulates your bowels, so they could make your symptoms worse. Contact the treatment helpline if you are having more than 4 episodes of diarrhea in 24 hours despite taking loperamide, if you have cramping pains in your abdomen, or if you have symptoms that last for more than a day.
You might develop mouth problems, which can include ulcers, also called oral mucositis, a dry or sensitive mouth, or oral thrush. This may be avoided by using an antiseptic mouthwash twice a day to help keep your mouth clean and by brushing your teeth or dentures regularly with a fluoride toothpaste. If you feel soreness in your mouth, start using an anti-inflammatory mouthwash called benzidamine. The common brand name is Difflam, but other brands are available. You can use this every 1.5 to 3 hours to help reduce the soreness. Both mouthwashes can be mixed with equal amounts of water to help prevent any stinging that the mouthwashes may cause. Use a lip balm to keep your lips moist and to prevent cracking, and try to avoid hot, spicy foods and drink plenty of water to stay hydrated, which will help prevent drying in your mouth. If you have soreness in your mouth that is making eating and drinking difficult, please contact the treatment helpline.
It is important not to get pregnant or to breastfeed while taking CDKs. Women of childbearing age and men with partners of childbearing age should use effective contraception whilst on treatment and for several weeks after. For females, this is for 3 weeks after finishing treatment, and for men, it is for 14 weeks. Some patients may experience issues with their skin, such as a rash, dry skin and itching. Moisturising regularly can help to avoid this, and your team can recommend appropriate creams or antihistamines if this becomes difficult to manage. On this treatment, some patients may experience some hair thinning. We have a leaflet that tells you more about looking after your hair and coping with hair loss, which can be provided by your team and is also available on the Velindre website. If you are offered immunisations whilst on this treatment, please contact your team for advice before accepting any vaccines.
There are some rare side effects which may occur. If so, you must seek urgent medical advice. Contact the treatment helpline or attend your nearest A&E straight away if you notice any of the following symptoms: swelling, heat, redness or pain in your calf, or new or worsening shortness of breath, any of which could be a symptom of a blood clot. Sudden onset of a cough with wheezing and breathlessness, which can indicate inflammation of the lungs. Any chest pain, including tightness in your chest, or if you feel aware of your heart beating too fast or too slow. Don't forget, it is not possible to list every side effect that may occur with this treatment. If you are feeling unwell with any new symptoms or have a symptom that is not explained in this video, it is important that you contact the treatment helpline straight away for advice.
If you need to contact Velindre, contact Velindre Cancer Services switchboard on 029 20 615 888. If you are unwell, ask for the treatment helpline. If you have any general queries about your treatment appointments, contact Velindre and ask for the booking line. If you have any general queries about your clinic appointments, contact Velindre and ask for your specific consultant secretary. If you have any general queries regarding your medication, contact Velindre and ask for the pharmacy or the treatment helpline if the pharmacy is closed. We hope you found this video helpful. We can't list all of the side effects, so please refer to the Electronic Medicines Compendium for more information, or ring the pharmacy at Velindre if you have a general query about your CDK.